Heart failure kills more people each year than all forms of cancer combined, yet it rarely begins with chest pain. The first signs are often so ordinary that people brush them off as aging, stress, or fatigue. But catching these early warnings can literally double your chances of survival. In this video, you'll discover 12 overlooked symptoms that may appear in your daily life, long before the heart reaches crisis. Stay with me, because knowing what to look for could save your life or the life of someone you love. 1. Shortness of breath during simple activities. One of the most common early signs of heart failure is feeling out of breath during activities that used to feel effortless. Walking across a room, climbing a single flight of stairs, or carrying groceries may suddenly leave you winded. This is called exertional shortness of breath. It happens when a weakened heart cannot pump enough blood forward, causing fluid to build up in the lungs. That fluid makes breathing harder, even when the activity itself is light. At first, many people dismiss this change as being out of shape or simply aging. But what matters is your personal baseline. If you notice that tasks you once did without a second thought now make you stop to catch your breath, it deserves attention. Keeping a simple diary of when and how often this happens gives doctors a clearer picture of your condition. The key is not to compare yourself to others, but to your own normal. If something that was once easy now feels unusually difficult, it could be your heart's way of asking for help. 2. Swelling in ankles and feet. Swelling around the ankles, feet, or lower legs is another early red flag. Doctors call this edema. In heart failure, it happens because blood is not moving as strongly as it should. Fluid backs up in the veins and seeps into the surrounding tissue. By the evening, shoes may feel tight, socks may leave deep impressions, and the skin may appear puffy. Many people blame this on standing too long, hot weather, or salty meals. But in heart failure, the swelling is usually symmetrical, affecting both legs, and it improves only slightly with rest. The important point is that the swelling is not just skin deep. It signals that circulation is under stress and the heart is struggling to handle fluid properly. A simple test you can do at home is to press your finger into the swollen area for a few seconds. If the skin leaves a pit that lingers, it is a sign of fluid retention. If this happens regularly, especially alongside fatigue or breathlessness, it is time to speak with your doctor. 3. Waking up breathless at night. Waking suddenly in the night, gasping for air, is another early sign of heart failure. Doctors call this paroxysmal nocturnal dyspnea. It happens because when you lie flat, fluid that has pooled in your legs during the day shifts back into the bloodstream. That extra fluid reaches the lungs, making it harder to breathe. For the person experiencing it, the sensation is frightening, waking in panic, desperate for air. Many mistake this for asthma, anxiety, or even sleep apnea. Some cope by stacking pillows or sleeping in a chair to stay upright. While this provides temporary relief, it does not address the underlying issue. The heart is already struggling at night, when the body should be at rest. If you notice you wake often feeling breathless, even if the feeling fades by morning, do not ignore it. Keep track of how many pillows you need to sleep comfortably, and how often the breathlessness occurs. This information gives doctors valuable insight into how much strain your heart is under. 4. Persistent fatigue and low energy. Another early sign is a steady, unexplained fatigue that does not improve with rest. In heart failure, the body directs blood to vital organs like the brain and heart, leaving less oxygen for the muscles. That shortage leaves you weak and drained. This is not the usual tiredness after a long day. It is a heavy, sluggish feeling that makes ordinary tasks exhausting. Walking the dog, cooking dinner, or even having a conversation may leave you worn out. Many describe it as a foggy weight that lingers no matter how much sleep they get. The tricky part is that fatigue can come from many causes, from stress to thyroid problems. But when it appears together with swelling, breathlessness, or nighttime breathing problems, it becomes a stronger clue that the heart is involved. Keeping track of when fatigue is most noticeable and how it limits your daily life helps doctors see the bigger picture and act before symptoms worsen. 5. Rapid weight gain from fluid retention. A sudden increase in body weight over a few days can be an early warning sign. This is not fat gain from overeating. It is fluid retention caused by a weak heart that cannot pump strongly enough to manage circulation. Clothes may feel tighter, rings may not fit, or the scale may climb by 2 or 3 kilograms in less than a week. Doctors often ask patients with heart conditions to weigh themselves daily for this reason. Rapid weight gain may show up before visible swelling appears, making it a very sensitive early signal. If you notice this happening without any change in your eating habits, it should not be ignored. Keeping a simple weight log at home can reveal patterns you might otherwise miss. If the gain is steady and unexplained, it may mean the heart is struggling to keep up. Early treatment at this stage can prevent the fluid from building to more dangerous levels. 6. Frequent nighttime urination. Getting up once during the night is normal, but if you find yourself waking multiple times, it may point to more than a bladder issue. In heart failure, fluid that collects in the legs during the day shifts back into the bloodstream when you lie down. The kidneys then work harder to filter the extra fluid, leading to frequent trips to the bathroom at night. This is called nocturia. The problem is often dismissed as aging or prostate trouble in men, but when it occurs with swelling or shortness of breath, it becomes a strong clue that the heart is struggling. This symptom not only disrupts sleep, but also masks the real problem. Keeping a simple record of how often you wake during the night helps doctors understand whether circulation and fluid balance are the underlying causes. 7. Persistent cough or wheezing. A cough that lingers for weeks can sometimes point to heart failure rather than the lungs. When the heart is weak, pressure builds in the veins leading to the lungs. This causes fluid to leak into the air sacs, irritating the airways. The result is a nagging, dry cough that often worsens at night. In more severe cases, the cough may bring up pink, frothy mucus, which is a clear sign of fluid in the lungs. Wheezing or a whistling sound when breathing may also occur. Many people mistake this for asthma, allergies, or a stubborn cold. If the cough does not improve with usual treatment, and especially if it happens with shortness of breath or swelling, it should be checked. A cough that gets worse when lying flat is particularly important to mention to a doctor. 8. Loss of appetite and nausea. When the heart struggles, it does not only affect circulation. Blood flow to the digestive system is also reduced, which can leave you feeling full after only a few bites. Fluid can also build up in the liver and abdomen, creating discomfort or nausea. This leads to a gradual loss of appetite. At first, this may seem harmless, since many things can cause poor appetite. But when it persists, and especially when it occurs with swelling, fatigue, or shortness of breath, it becomes an important warning sign. The danger is that poor appetite reduces nutrition at the very time the body needs it most. Weakness and weight loss that follow can make heart failure harder to manage. If meals are leaving you uncomfortable, or you notice you are eating much less than usual, do not dismiss it as stress or indigestion. It may be your heart sending a signal. 9. Irregular or rapid heartbeat. A healthy heart beats in a steady rhythm. In early heart failure, that rhythm may become irregular or faster than normal. People often describe it as a flutter, a pounding, or skipped beats that they notice most when resting. This happens because the heart is working harder to push blood, and its electrical system is under stress. If the rhythm is irregular, blood does not flow as smoothly. That can leave you lightheaded, dizzy, or unusually tired. Occasional skipped beats are common in healthy people, especially with stress or caffeine. But if palpitations occur often, last longer than a few seconds, or come with other symptoms, they should be taken seriously. Keeping note of when they happen and what you were doing at the time gives doctors important clues about your heart's condition. 10. Difficulty concentrating or confusion. The brain depends on a constant supply of oxygen-rich blood. When the heart weakens, that supply may fall short. The result can be subtle changes in thinking, such as difficulty concentrating, forgetfulness, or a sense of mental fog. It may feel like your thoughts are slower, or you lose track of conversations. These symptoms are easy to blame on aging or stress, but when they appear with other signs such as fatigue, swelling, or shortness of breath, they may point to circulation problems. Doctors sometimes discover early heart failure in patients who come in for memory issues rather than chest symptoms. If you or someone close to you notices unusual confusion or a decline in focus, especially if it appears suddenly, it deserves medical attention. 11. Abdominal swelling. Most people expect swelling in the legs, not in the stomach. But in heart failure, fluid can also collect in the abdomen, a condition called ascites. This creates a heavy, tight, or bloated feeling that does not improve with diet changes. Clothes may feel tighter at the waist, or meals may feel uncomfortable because of pressure on the stomach. Unlike bloating after a meal, this swelling is persistent and often grows gradually. It can also appear with swelling in the legs or fatigue. Because it is easy to mistake for a digestive issue, many people overlook it as a heart-related symptom. Checking for changes in waist size is a simple way to monitor this at home. If abdominal swelling continues for days or weeks without explanation, it may be time to ask your doctor about your heart. 12. Dizziness or lightheadedness. Feeling faint or lightheaded occasionally can be normal, but frequent dizziness may point to reduced blood flow. In heart failure, the heart cannot pump strongly enough to keep blood pressure stable. This can cause sudden drops, especially when standing up quickly. Some people feel unsteady just walking across a room or after mild activity. Others describe episodes where the room spins or their vision narrows. These events can be dangerous because they increase the risk of falls and injuries, especially in older adults. Many dismiss dizziness as dehydration or standing too quickly. But if it occurs often, and particularly if it comes with palpitations, fatigue, or shortness of breath, it could be a sign of heart strain. Keeping a diary of when it happens, how long it lasts, and what you were doing at the time can help doctors uncover the cause more quickly. The body often gives gentle warnings long before heart failure becomes severe. Breathlessness, swelling, fatigue, coughing, or even subtle changes in memory can all be signals. The key is to notice patterns, compare them with your usual baseline, and bring them to your doctor's attention early. Heart failure is serious, but catching it in the early stages makes treatment far more effective. Small changes in your daily life, how you walk, how you sleep, how you breathe, may be your body's first signal to act. If you found this video helpful, please like it, share it with someone who could benefit, and subscribe to our channel for more practical health tips. Your support helps us reach more people who are looking for ways to protect their health and live longer, stronger lives.